Welcome viewers. Today we are going to show you a case of diagnostic cystoscopy being performed in a patient at the end of a difficult laparoscopic hysterectomy. The main reason for doing this diagnostic procedure is to find out if there is any ureteral damage that may have occurred during the laparoscopic procedure. We are planning to observe if there is any damage which may have inadvertently occurred to the ureters during the laparoscopic hysterectomy. On your screen you see the opening of the left ureter and jets of urine are coming out of it. Now we turn the scope to the opposite side and we patiently wait for a clear jet from the right ureteric orifice. Here we see a clear stream of urine coming out from the right opening. Now we turn our attention upwards to look at any mucosal damage that may have occurred. A few areas of congestion are noted on the bladder mucosa. These are expected and normal finding after a laparoscopic hysterectomy. Diagnostic cystoscopy after laparoscopic hysterectomy is an invaluable tool which helps in ruling out almost 80 to 90% of injuries to the bladder and ureters. A clear stream of urine coming out from the ureteric orifices rules out most of the damages done to the ureters. We perform routine diagnostic cystoscopy at the end of most of our difficult laparoscopic procedures to rule out any inadvertent damage which may have occurred to the urinary system. Thank you very much for viewing this video. Have a nice day.